This is Kathy Knipfer, instructor for Nursing 2203, recording the Pediatric lecture for Chapter 37, Impact of Cognitive or Sensory Impairment on the Child and Family. Cognitive impairment, or CI, is a general term that encompasses any type of mental difficulty or deficiency. It's used synonymously with intellectual disability. The diagnosis is made after a period of suspicion by the family or healthcare professionals. In some instances, though, it's made at birth, such as with Down syndrome and fetal alcohol syndrome. Sometimes it's diagnosed later when delays are seen in gross and fine motor development or speech development. The definition of intellectual disability in children consists of three components: intellectual functioning, which means sub-average intellectual function consisting of an IQ of 70 to 75 or below, functional strengths and weaknesses, which would involve an impairment in 2 out of 10 adaptive skills, and then an age younger than 18 at the time of diagnosis. The adaptive skill areas used to evaluate functional impairments are communication, home living, community use, leisure, health and safety, self-care, social skills, academics, work, and self-direction. Results of standardized tests are used in making a diagnosis of cognitive impairment. Diagnosis of mildly impaired characterizes 85% of the population with cognitive impairment. These individuals are educable. Diagnosis of moderately impaired characterizes 10% of the population with cognitive impairment, and these individuals are trainable. Causes of cognitive impairment can include intrauterine infection and intoxication, trauma, which may be prenatal, perinatal, and postnatal, metabolic or endocrine disorders, inadequate nutrition, as well as postnatal brain disease. Additional causes of cognitive impairment can include the unknown prenatal influences, chromosomal anomalies, prematurity, low birth weight, postmaturity, psychiatric disorders with onset in childhood, as well as environmental influences. Nursing care of children with impaired cognitive function include educating the child and family, as well as early intervention, teaching the child self-care skills, promoting the child's optimal development, as well as encouraging play and exercise. This child is using a push panel that allows the child to turn on the computer and turn off the computer. Crawling movements can be encouraged by placing an attractive object outside the child's reach. This child is using a manual switch to play with a battery-operated toy. Favorite toys provide stimulation. The nurse taking care of a child with impaired cognitive function should also provide a means of communication, establish discipline, encourage socialization, provide information on sexuality as appropriate, help families adjust to future care, and also care for the child during hospitalization. This child is moving a device near her head to activate electronic and communication equipment. There are some specific measures to help prevent cognitive impairment. They are counseling and education regarding nutrition and tobacco use, awareness of danger of chemicals including prenatal exposure to alcohol, rubella immunization, genetic counseling, and folic acid supplementation to prevent neural tube defects. Down syndrome is the most common chromosomal abnormality. It occurs 1 per 691 to 1,000 live births. The causes are unknown. They're probably multiple. It occurs in populations of all races. The causes of Down syndrome include nonfamilial trisomy 21. There's an extra chromosome 21 in 95% of the cases. Also, in 3 to 4% of the cases, there's a translocation of chromosomes 15 and either 21 or 22. In 1 to 2% of the cases, mosaicism, which is a mixture of abnormal and normal cells, occurs. Maternal age has also been identified as a cause. Mothers over the age of 35 have an increased risk, 1 per 350 births. Age 40, the risk is 1 per 100 births. Diagnosis of Down syndrome is based in part on clinical manifestations. Some of the common ones include square head with an upward slant to the eyes, flat nasal bridge, protruding tongue, and hypotonia. You should also refer to box 37.3 on page 1090. It is also diagnosed through chromosomal analysis. There are physical problems that are often associated with Down syndrome: congenital heart disease, hypothyroidism, and leukemia. This picture represents the common characteristics of an infant with Down syndrome. Therapeutic management of Down syndrome includes possibly surgery to correct congenital anomalies, evaluation of hearing and sight, and periodic testing of thyroid function. It is important for the nurse to provide support to the child's family at the time of diagnosis and to help prevent physical problems, and also to assist in prenatal diagnosis and genetic counseling. Fragile X syndrome is caused by an abnormal gene on the lower end of the long arm of the X chromosome. It is the second most common genetic cause of cognitive impairment after Down syndrome. It occurs 1 per 3,600 boys and 1 per 4,000 to 6,000 girls. Clinical manifestations of Fragile X syndrome include a large head circumference, a long face with a prominent jaw or prognathism, large protruding ears, large testes, postpubertal. The manifestations are variable in the female carriers of the gene. Classic behavioral features of Fragile X syndrome include mild to severe cognitive impairment, delayed speech and language, hyperactivity, hypersensitivity to taste, sounds, and touch, autistic-like behaviors, and aggressive behaviors. Therapeutic management of Fragile X syndrome includes Tegretol or Prozac for behavioral control, stimulants for hyperactivity. It would be similar to management of attention deficit hyperactivity disorder, referral to early intervention programs, and genetic counseling. A normal lifespan is expected. Hearing impairment occurs in 1 to 6 per 1,000 healthy full-term infants and in 2 to 4 per 100 premature infants. Those with a slight to moderately severe hearing impairment have residual hearing, usually with the use of an aid. They can process linguistic information. Those that have severe to profound hearing loss cannot process linguistic information with or without a hearing aid. Hearing impairment may be caused by anatomic malformation, family history, low birth weight, ototoxic drugs such as prolonged oxygen administration, chronic ear infections, perinatal asphyxia, perinatal infections, and cerebral palsy. A conductive hearing loss is associated with the middle ear. It has to do with the intensity of sound. A sensorineural hearing loss has to do with damage to the inner ear or auditory nerve, and it's more difficult to treat. A mixed conductive sensorineural loss involves interference with the transmission of sound. There also may be a central auditory interception, which is organic or functional. Symptom severity of hearing impairment is measured in decibels. It's a unit of loudness. It is measured at varying frequencies. The hearing threshold is the measurement of an individual's hearing by means of an audiometer. The severity of hearing impairment affects speech. You should refer to Table 37.2 on page 1094 for details. Therapeutic management of hearing impairment may include medical or surgical interventions, as well as hearing aids. It would be important to stress to parents the importance of storing batteries for these hearing aids in a safe location that is out of reach, and to also teach children not to remove the batteries for any reason. Battery ingestion requires immediate emergency management. The pediatric patient also might receive cochlear implants or multi-channeled implants. Here's an example of an on-the-body hearing aid. This child also has strabismus. Manifestations of hearing impairment in infancy include lack of startle reflex, absence of reaction to auditory stimuli, absence of well-formed syllables by age 11 months, general indifference to sound, and a lack of response to the spoken word. Manifestations of hearing impairment in childhood. Hearing impairment is likely to be diagnosed in infancy. If it is not detected in infancy, it's usually identified upon entry into school. These children may have abnormalities in speech development as well as learning disabilities. Promoting communication for children with hearing impairments. Of primary importance is the effect of hearing impairment on speech development. A child with a mild conductive hearing loss may speak fairly clearly, but in a loud, monotone voice. A child with a sensory neural defect usually has difficulty in articulation. Methods that can be used include lip reading, cued speech, sign language, speech language therapy, additional aids, socialization, and support of the child and family. When caring for a hospitalized child with a hearing impairment, the nurse should reassess the child's understanding of instructions that have been given. The nurse should supplement with visual and tactile media, as well as provide communication devices such as picture boards with common words. The nurse can also use the assistance of a child life specialist and other additional aids. Measures that can help prevent hearing impairment include treatment and management of recurrent otitis media, prenatal preventive measures such as genetic testing, avoidance of ototoxic drugs, testing to rule out syphilis, rubella, or blood incompatibility, also avoidance of exposure to noise pollution. Visual impairment is a common problem during childhood. In the United States, the prevalence of blindness or serious visual impairment is 30 to 64 per 100,000. It occurs in 5 to 10% of all preschoolers. Visual impairment is identified through vision screening programs. Visual impairment can be classified as partial sight or legal blindness or severe permanent visual impairment. Partial sight or partial visual impairment is defined as a visual acuity between 20/70 and 20/200. Legal blindness or severe permanent visual impairment is defined as a visual acuity of 20/200 or lower. Visual impairment may be caused by prenatal infections, retinopathy of prematurity, trauma, postnatal infections, and other disorders such as sickle cell disease, juvenile rheumatoid arthritis, or Tay-Sachs disease. Types of visual impairment. Refraction is the bending of light rays through the lens of the eye. Myopia is nearsightedness. That's the ability to see objects clearly at close range but not at a distance. Hyperopia is farsightedness, where the individual has the ability to see objects at a distance. Strabismus is a malalignment of the eyes, and amblyopia is lazy eye. It consists of a reduced visual acuity in one eye. Trauma is a common cause of blindness in children. Injuries to eyeballs or adnexa include penetrating injuries. Those injuries would be associated with sharp instruments, propulsive objects, blunt objects, or motor vehicle accidents. Non-penetrating injuries would be lacerations, blows to the eyes or head, and burns. The treatment is aimed at preventing further damage. It would be important for you to review the emergency eye injuries box on page 1099. An important intervention to remember is to never remove an object that has penetrated the eye. For irrigating the eye for chemical burns, irrigation should continue for 20 minutes. For a penetrating injury to the eye, apply a fox shield, not a regular eye patch, and then put a patch over the unaffected eye to prevent that bilateral movement. The most common eye infection is conjunctivitis. The treatment is usually with ophthalmic antibiotics. Systemic antibiotics may be used in some cases, especially severe infection. Steroids should be used cautiously because they may exacerbate viral infections. Infection control is an issue because of the contagious nature of conjunctivitis. Care management of the child with visual impairment. The nurse should identify children who, by virtue of their history, are at risk. The nurse should also observe for behaviors that indicate a vision loss and screen all children for visual acuity. The nurse should suspect visual impairment in any child of any age whose pupils do not react to light. The nurse should promote parent-child attachment for the child with visual impairment. The nurse should also promote the child's optimal development. Some aids or special arrangements may be needed to promote development and independence. The nurse should encourage play and socialization and provide alternative education such as the use of braille, audiobooks, and other learning materials. When caring for a hospitalized child with a visual impairment, the nurse should provide a safe environment. The nurse should provide reassurance during all treatments and orient the child to the surroundings. The nurse should encourage independence, and the treatment team members should be consistent. Measures that help to prevent visual impairment with children include prenatal care and prevention of prematurity, rubella immunizations for all children, safety counseling for preventing eye injuries, and periodic screening of all children. A combined hearing visual impairment has a profound effect on development. Motor milestones are usually achieved, while other development is often delayed. One technique that can be used is finger spelling. Words are spelled into the child's hand, and they spell it into another person's hand. It would be important for the nurse to assist in developing future goals for the child, such as care over the child's lifetime. A retinoblastoma is the most common congenital malignant intraocular tumor in children. It occurs in 11 cases per million annually. It primarily affects children younger than 5 years of age. It is caused by a genetic mutation or it is inherited. It may require enucleation if there is not a possibility of salvaging the vision. This picture shows an infant with a retinoblastoma. You can see the white reflection of the child's left eye. The light is reflecting off the tumor. This is the same infant with a left prosthetic eye. Autism spectrum disorders, or ASDs, are complex neurodevelopmental disorders that are accompanied by intellectual and social alterations. They may have verbal effects as well as repetitive and restrictive behavior patterns. They occur 1 per 100 to 150 children. They are 4 times more common in boys. ASD may be a genetic disorder of prenatal and postnatal brain development. There may be immune and environmental factors that may interact with the genetic susceptibility. There is a relatively high risk of recurrence of ASDs in families with one affected child. With ASD, peculiar and bizarre characteristics occur in specific areas, primarily socialization, communication, behavior, difficulty with eye and body contact, as well as a language delay. Early recognition of behaviors is critical to implement appropriate interventions and family involvement. Diagnosis is often delayed until age 2 to 3 years. ASD is a severely disabling condition. There is no cure for autism. Some children do improve with acquisition of language skills and communication with others. Numerous therapies have been used successfully, such as highly structured and intensive behavior modification programs. The objective in treatment is to promote positive reinforcement, increase social awareness of others, teach verbal communication skills, and decrease unacceptable behaviors. Providing a structured routine for the child to follow is a key in the management of ASD. Families experiencing ASD need support. Autism often becomes a family disease. Frequently, parents express guilt and shame. The nurse should stress the importance of family counseling. A good resource is the Autism Society of America. As much as possible, the family is encouraged to care for the child in the home. The family may require assistance in locating a long-term placement facility as the parents age. Question. The nurse is discussing sexuality with the parents of an adolescent girl with moderate cognitive impairment. What should the nurse consider when dealing with this issue? A. Sterilization is recommended for any adolescent with cognitive impairment. B. Sexual drive and interest are limited in individuals with cognitive impairment. C. Individuals with cognitive impairment need a well-defined concrete code of sexual conduct. And D. Sexual intercourse rarely occurs unless the individual with cognitive impairment is sexually abused. The answer is C.